Turning now to our coronavirus coverage and new numbers on the COVID cases. They're falling, but not low enough to please the nation's health leaders. They're keeping their eyes on Louisiana and really a lot of the South because of yet another variant. WDSU's Harrison Golden joins us live from Ochsner Baptist with concerns and, Harrison, a new warning from experts.
Yeah, Travers, well, city, state, and federal health leaders, they are all watching the so-called Delta variant of COVID-19. It has already clogged hospitals across India, dominated much of the United Kingdom, and they warn if our part of the world isn't careful, it could spike here.
Not out of the woods by any means.
That's what Dr. Jennifer Avegno told the New Orleans City Council Tuesday, noting a COVID strain more contagious than any other we've seen.
The more we allow it to fester in our state, the more we're just inviting those variants that are going to outsmart the vaccines.
Louisiana has only reported a few cases of the so-called Delta variant so far, but CDC Director Dr. Rochelle Walensky fears the state has more cases out there.
I'm not surprised to see that places that might have less vaccination coverage, like in the South, might also be those most susceptible to have more variants, like the Delta variant that came from India.
The National Institutes of Health says current vaccines should protect people from this variant, but Walensky claims Louisiana's lingering vaccination gaps leave the state risking higher caseloads and more resistant strains down the road.
And we encourage policymakers to make decisions based on both of those parameters.
We are not able to maintain low levels of COVID in the community, then it may be that we need to revisit some of the measures that were in place before to control COVID.
But Dr. Catherine Baumgarten with Ochsner Health says no need to revive those restrictions yet, as long as more people get their shots.
The good news is the vaccines look like they are effective, so the best way to prevent from getting any COVID at this point, including variants, is to be fully vaccinated.